The agency that I have been working with for my field placement is called Bethlehem Haven. Bethlehem Haven is a women's shelter located in Pittsburgh, Pennsylvania. In 1981, Reverend Peter Weaver of Smithfield United Church of Christ in downtown Pittsburgh opened the doors of the church to a group of homeless women on Christmas Eve. In this moment, Bethlehem Haven was born. The shelter operated in the basement of UCC in those early years, but in the year 2000, Bethlehem Haven moved to a new location in the uptown area of Pittsburgh. This transition allowed the organization to expand its programs by adding transitional housing, permanent supportive housing, a health clinic, and employment services. In 2007, Bethlehem Haven acquired a second location, expanding its total number of beds in transitional housing to 96. The emergency shelter also opened at this time. Then, in 2016, due to reductions in government funding, Bethlehem Haven joined forces with Pittsburgh Mercy Family Care. Currently, Pittsburgh is rapidly evolving, expanding, and undergoing an urban renewal. Although this is well-intentioned, it has detrimental effects on some of the city's residents. The city now has fewer income-restricted apartments and houses than people who need them, and rent is rising faster than renters' income. On average, there are around 1,000 homeless individuals on any given night in Pittsburgh. This number includes only those staying in a shelter or are unsheltered. What this number doesn't include is those who are staying with friends or family or doubling up. Bethlehem Haven is often referred to as simply the Haven. Hospitality, compassion, integrity, and empowerment are the core values of Bethlehem Haven. These are at the centerpiece of the agency's delivery of service to homeless women and those at risk of homelessness. Bethlehem Haven's mission is to provide a continuum of care for homeless women that leads towards self-sufficiency. Bethlehem Haven's vision is to end homelessness through collaboration with the community and the people served. Bethlehem Haven believes that a secure home is an essential foundation for clients to achieve stable mental and physical health, as well as personal empowerment. The agency prioritizes finding safe, affordable, and permanent housing. They do so by connecting clients to permanent housing without preconditions or barriers to entry, such as sobriety, treatment, or service participation requirements. The program that I am involved with is the agency's medical respite program. Homelessness often complicates efforts to treat illnesses and injuries, and the outcomes can easily become disastrous. Bethlehem Haven provides care for homeless individuals who are too ill or frail to recover from a physical illness or injury on the streets, but who are not too ill to be in the hospital. The Haven offers safe, temporary housing coupled with home, healthcare, and on-site supportive services. Bethlehem Haven has operated a 5-unit medical respite center with Allegheny Health Network since January 2016. Due to its success, a group of leaders from Bethlehem Haven, Allegheny Health Network, Allegheny County Department of Human Services, Pittsburgh Mercy, the University of Pittsburgh Medical Center Health Plan, and UPMC Mercy convened to develop a larger community-based medical respite center. Currently, Bethlehem Haven operates a 29-unit medical respite program. Clients are referred to the program from one of the healthcare providers within the program's collaboration. If accepted into the program, clients stay, on average, 30 days. To date, Bethlehem Haven has served 43 clients in its medical respite program. To further assist in serving our most vulnerable, the agency is considering ways to intake clients from the street. The medical respite program is funded by the Allegheny Health Network, UPMC Mercy, UPMC Health Plan, and through private donations. Clients' first and foremost priority while staying in respite is to attend to their medical needs. However, they are often linked to many other important services such as drug and alcohol counseling, employment services, mental health counseling, and housing services. Case management is the primary method in which services are delivered to clients. While staying at Bethlehem Haven, clients are connected to health insurance benefits, primary care, and assisted with transportation to and from medical appointments during their stay. The staff at Bethlehem Haven uses a trauma-informed, housing-first approach in their method of service delivery. However, the agency also utilizes harm reduction in its treatment strategy. Harm reduction is an approach aimed at reducing the risks and harmful effects associated with substance use and addictive behaviors, providing the client with choice. Harm reduction neither condones or condemns any behavior. It embraces respect, trust, and a non-judgmental stance. The individual is expected to take responsibility for his or her own behavior, and there are no predefined outcomes. Many people experiencing homelessness have complex health challenges that both contribute to and are exacerbated by homelessness. They generally have limited access to health care because they are often unemployed, lacking employer-sponsored insurance, and living in poverty. As a result, many people experiencing homelessness have had to rely on emergency room visits and uncompensated hospital care. The Affordable Care Act makes health insurance more accessible and affordable and ensures coverage for healthcare services that can help support people as they exit homelessness. Medicaid is the health insurance option for most people experiencing homelessness. Ms. Deborah Linhart became the CEO of Bethlehem Haven in 2016. She has spent most of her career focusing on gender-based, nonprofit healthcare services and has been instrumental in developing several successful programs to address the holistic health and well-being of women. Also part of the leadership team is Dr. Sharon Higginbotham, the Chief Operating Officer. Within the medical respite program, the staff includes a manager, physician, nurses, 2 licensed social workers, 1 that works in-house and another that is contracted out of Allegheny Health Network, a housing coordinator, and the residential support staff. As a social work intern, I have my own caseload and carry out the same responsibilities as the staff's licensed social workers. Once a client is admitted, I will meet with them to discuss their housing needs and connect them to the identified supportive services they desire. Although Bethlehem Haven now operates under Pittsburgh Mercy, it has retained its own board of directors and leadership. There are 19 board of directors, 4 emeritus members, and a community council made up of 17 individuals. There is this old age belief that homelessness is a result of poor choices, laziness, or irresponsible behavior, but many people seem to be realizing and recognizing the economical factors that contribute to homelessness, such as the lack of affordable housing, low wages, and unemployment. Homelessness is a complex problem, and many people have a hard time wrapping their heads around the issue. The homeless population is also overgeneralized. There are numerous reasons that lead to homelessness, and not one story is the same. This limited view prevents people from seeing homelessness as a broad social issue that affects many kinds of people, not just those who are mentally ill, physically disabled, or use drugs and alcohol. No one chooses to be homeless. For the last 37 years, Bethlehem Haven has provided nearly 13,000 nights of shelter every night. Each year, it provides nearly 60,000 meals, sees around 600 men and women in the health and wellness clinic, fills countless physical and emotional needs for residents, and provides employment training for more than 100 men and women in the community. Thank you for taking the time to listen to me speak about my agency. If you have any questions, please feel free to reach out to me and I'd be happy to answer your question. Thanks.